Today marks a defining moment for Burkina Faso as the nation strides confidently toward medical independence. Through a collaboration with India, construction begins on West Africa's inaugural state-of-the-art cancer treatment and research facility right in Ouagadougou. This is not merely assistance, but a partnership of equals, bringing exceptional healthcare, scientific research, and professional training to our citizens, ensuring that not a single person from Burkina Faso must travel abroad to receive critical treatment. In the brightly lit operating theater, the sterile white lights shone against gleaming metal surfaces. A little girl rested on the surgical table, her delicate chest rising and falling gently beneath the steady rhythm of anesthesia. Encircling her, a team of surgeons moved with calm expertise, some clad in white coats adorned with the Burkina Faso emblem, others displaying insignia from India's foremost cancer hospitals. This surgery was not simply about preserving one life. It was a pivotal chapter in history. Seconds passed. Monitors echoed their steady signals. A tumor, roughly the size of a modest orange, was being removed with technology so advanced it had never found its way into West Africa before. This was not a mission orchestrated by external charities or aid organizations. It was Burkina Faso's own physicians working side by side with Indian experts, embarking on the very first phase of what President Ibrahim had pledged, a homegrown, cutting-edge cancer center in Ouagadougou. But how did such an ambitious vision come to fruition? And what led India, residing thousands of miles distant, to become the principal ally in this life-saving endeavor? To unravel this, we must look back, before the negotiations, before the first scalpel touched skin, to a relationship that has been quietly maturing for decades. Long before the cancer center was even imagined, Burkina Faso and India were nurturing a subtle, steadfast bond. It all started in 1976, when the Minister of Commerce led a delegation to New Delhi. That mission concluded with an agreement on economic and technical cooperation. A modest headline then, but the very first stone set in a bridge between the two nations. In the ensuing years, the partnership flourished. India provided agricultural equipment, tractors, tillers, spare parts, empowering local farmers to modernize their practices. Scholarships and skills development programs like the C.V. Raman Fellowship opened doors for students. India also introduced solar electrification initiatives to rural communities. By the time President Ibrahim assumed leadership, India had become a valued friend, but he saw beyond friendship. He recognized a chance to transform the landscape of African healthcare. On June 26, 2025, Burkina Faso inked new cooperation agreements with 8 countries. India was not just among them, it stood at the forefront. The reason was clear. India possessed something no Western partner could offer so effectively. It had a proven history of establishing world-class medical infrastructure at costs manageable for African states, and a philosophy rooted in South-South cooperation, nations supporting each other as equals, not as benefactors and beneficiaries. Yet, a strong alliance and a world-class cancer facility are not one and the same. The catalyst for this project was not only diplomatic goodwill, but a transformative medical breakthrough that revealed the potential of their collaboration. Prior to 2024, those in Burkina Faso needing a kidney transplant faced 2 grim choices: endure endless years hoping for a rare overseas medical visa, or forego treatment altogether. Then everything changed in a single day that rewrote the nation's history. A patient was prepared for what would become Burkina Faso's first kidney transplant. Indian nephrologists stood alongside local surgeons, guiding every incision and suture, while sophisticated medical equipment, brought in under a special cooperation agreement, hummed steadily. After several hours, the surgery was declared a triumph. News of the transplant rippled throughout the country. For countless citizens, it was the first time they had heard of such a complex procedure taking place entirely within Burkina Faso. For President Ibrahim, it was validation that his vision could be realized. If such a feat could be accomplished safely and successfully, why limit themselves to a single specialty? Why not aspire to create a center capable of confronting one of the most lethal and challenging diseases on the planet? India's own journey positioned it as the perfect collaborator. The nation had transformed itself from having minimal oncology capabilities in the 1980s to standing at the forefront of innovative and affordable cancer care worldwide. The government recognized that they could accelerate this transformation by importing not only medical machines, but also comprehensive systems, specialized training, and deep expertise. That kidney transplant was far more than a breakthrough procedure. It became a beacon, illuminating a future to be constructed piece by piece in Ouagadougou, on land designated to become West Africa's very first advanced cancer treatment and research facility. When would this dream become a reality? The announcement of the Cancer Center generated excitement, but doubters dismissed it as wishful thinking. How could a country still developing its basic healthcare suddenly advance to sophisticated oncology? The answer was found in India's Basavatra Kamindo American Cancer Hospital and Research Institute in Hyderabad. This Indian nonprofit had earned global respect by merging exemplary patient care with active research, all at a fraction of the costs seen in Western countries. Its leadership agreed to share far more than just clinical protocols. They offered the architectural and operational blueprint needed to build such a center from the ground up. The strategy rested on three foundational pillars: treatment, research, and training. The treatment arm would deliver state-of-the-art surgeries, radiation, and chemotherapy, all adapted to the distinct cancer trends in the region. The research component would analyze how factors like nutrition, local environment, and genetics influenced cancer rates. Meanwhile, the training pillar would equip doctors, nurses, and laboratory personnel to operate the center independently within 10 years. India's contribution extended beyond advice. It pledged to provide the initial equipment, send rotating teams of specialists, and organize immersive training for medical staff within Indian hospitals. The vision was ambitious, yet making it a reality would require overcoming the greatest obstacle of all, developing the physical and human infrastructure to support it. In Ouagadougou, cranes towered over the city as the cancer center's foundations were laid. However, this was not a straightforward project. Frequent power shortages threatened to delay construction, and bringing in radiation machines meant navigating layers of bureaucratic paperwork. The government responded by forming a specialized medical infrastructure task force. Yet perhaps the most daunting barrier was not physical, but psychological. Many citizens still believed that advanced diseases such as cancer could only be treated overseas. To address this, the Ministry of Health launched media campaigns featuring authentic stories from patients, survivors, and physicians who detailed the services soon to arrive. The real shift happened when the first section of the center began offering outpatient screenings ahead of schedule. Crowds gathered outside, eager to participate in something transformative and hopeful. Every patient who entered marked a small triumph, demonstrating that trust was beginning to take hold. With this trust, the path opened to the next stage. The mission was now to elevate the center from a treatment facility to a research leader. Conquering cancer is not simply about caring for patients. It requires understanding the disease within its local context. For many years, Burkina Faso had little data on its unique cancer trends, but the new partnership would change that. Indian oncologists helped set up laboratories within the center, introducing procedures for tumor sample analysis, tracking patient outcomes, and conducting broad population studies. Doctors from both countries began co-authoring scientific papers, sharing discoveries at international forums. The research brought immediate insights. Certain cancers appeared more often in rural farming areas, possibly linked to environmental hazards like pesticides. The number of pediatric lymphoma cases was higher than anticipated, which led to targeted outreach for early diagnosis in rural clinics. These findings had a direct impact on patient care, enabling doctors to customize treatments to the realities of West African patients rather than relying solely on data from Europe or North America. Yet, for all its expanding abilities, the center's true impact reached far beyond the realm of medicine. It was quietly nurturing something more profound, a spirit of autonomy within the healthcare system. For many decades, Healthcare across Africa had been molded by reliance on external assistance, by charity-driven missions, and by expertise brought in from abroad. This center, however, marked a turning point by forming a partnership with India. Burkina Faso deliberately embraced a model built on mutual respect. India was not laying down conditions, it was joining forces. Instead of dispensing aid, it offered knowledge, technological advancements, and operational systems that Burkina Faso could truly claim as its own. This transformation carried immense weight. From an economic perspective, it meant that fewer families were compelled to plunge into financial ruin by seeking care in distant countries. In medical terms, it signaled the rise of a new generation of specialists able not only to heal, but also to mentor those who would follow. On the political stage, it stood as proof that African nations could initiate ambitious, top-tier projects without depending on the established powers of the Western world. Perhaps most inspiring of all, the ripple effect began to spread. Delegations from neighboring states soon paid visits, and conversations sparked about regional collaborations, joint research archives, and reciprocal training opportunities. The once distant vision of a West African oncology alliance was inching closer to reality. It was no longer just a concept, but a tangible goal within sight. All of this stemmed from one profoundly symbolic event, the day a young girl stepped into an operating theater and emerged with a renewed lease on life. Mere weeks after her operation, the little girl introduced at the beginning of our story returned to her family's compound, playing in the dusty courtyard. Her laughter drifted along the street, a sound commonplace for many, but for her, nothing short of miraculous. The center that gave her this second chance continues to expand. More equipment arriving, more healthcare professionals receiving instruction, more patients passing through its welcoming doors. Yet it has already become more than a medical facility. It stands as a declaration that Burkina Faso is capable of developing exceptional healthcare on its own terms, collaborating with partners who honor its independence. For Ibrahim, it is a testament that daring dreams need not remain empty political slogans. They can become concrete, steel, precision instruments, and the promise of hope restored. And to every future patient, it is a solemn vow. The battle against cancer in West Africa no longer begins at the departure gate of an airport. It starts right here, at home.